Alrighty, today I will be presenting fetal alcohol syndrome. So fetal alcohol syndrome is a condition occur in pregnant mothers who are exposing the fetus to alcohol early on in birth, as well as can be throughout. This can be diagnosed early on after the baby is born. You can see this through their physical features and a lot of the developmental factors that they are not achieving. Some signs that you can look for. All these symptoms can include your child. Some of these are related to other conditions that can occur with fetal alcohol syndrome, but some of the common symptoms that you can look for are low body weight, speech and language delays, small head size, abnormal facial features such as a smooth ridge between the nose and the upper lip, and then vision or hearing problems, and then a poor memory. Those are some of the most physical features. Some of the developmental factors that you could spot is a shorter than average height, delayed speech, vision and hearing problems, and then, like I said before, you could also develop other disorders, which could be alcohol-related birth defects or neurodevelopmental disorders. Including all of that, there have been a couple of different types of interventions that have been available to people who struggle with fetal alcohol syndrome. A lot of these intervention types are best if they are caught very much early on. Most steps you would want to go to your healthcare provider to spot some of the physical attributes that you see, but some of those within the classroom are going to be mostly between teachers and the child would be best, or a para who is along with the child who can help this intervention process. But what a lot of that looks like is redirecting the child, providing individual attention for them, establishing a positive relationship with them, facilitating partner work, attendance to the seat assignments, and promote the promotion of self-control. A lot of these strategies are between the teacher and student, but it's also important that family members are included in this process to make sure that that's also being directed at home. So then both of the communication processes are the same. Some of the steps that or resources that would be helpful is going to your healthcare provider to spot some of those early signs. There is no testing required for this diagnosis. The child can be seen having a shorter attention span as well as hyperactivity within the classroom that can help diagnose this syndrome. This diagnosis can be very comparable to ADHD, which can be misdiagnosed with having fetal alcohol syndrome, but can be a result of having it. And based on this hyperactivity, based off of all the physical attributes that you could be seeing, the determining factor is those developmental stages that they are being slower to. And then some of the resources that I was able to find that was most helpful is a few different ones. One of them is a lot of through government issued prevention intervention for these that provide support for your child, counseling for your child, as well as a lot of support for the mothers who a lot of times you can't even tell that you're pregnant even after the consumption of alcohol, so it's sometimes even hard to diagnose later on, and you have a lot of guilt. So a lot of the resources do pertain to the mothers as well. A lot of these are through health and medical resources, but a lot of them can be sought out from the schools that these kids are attending. They can help the child find the best path for them to be supported in this. So it's important to try to catch it early on, try to have the best path for them in order to be successful in the classroom. So that is fetal alcohol syndrome. A lot of it has to do with, those developmental factors, but to spot it very early on, it's a lot of those facial features and other physical attributes that you could see. Thank you very much.